Center. And so thank you for joining us today, and to the doctors for everything that they do for our community and their safety and their health. And thank you for taking time out of your busy schedule to be with us today. These are our doctors. We have Dr. Perez. We also have Dr. Toranelli and Dr. Lee that is joining us. Thank you, ladies, so much for being with us today and really sharing your expertise in your fields. My name is Mary Helen. I'm the program director for our Women's Business Border Center. And I just really wanted to share with you a little bit more about our center, about our Hispanic Chamber. And both of our organizations it's a very good time for us because we are celebrating our 30th year in operations for the Hispanic Chamber. And for our Women's Business Border Center, we've been serving our business community for 20 years now. So it's something to celebrate and some good milestones for us that we have reached. Our main mission at the El Paso Hispanic Chamber is to be the leading resource and to support the growth of our small minority, women, and veteran-owned businesses. El Paso is a growing business, has a very big growing business community, and we're happy to support that growth and provide all the necessary tools for our businesses to succeed. With our Women's Business Border Center, we're not only, our program is not just geared for women, but it's open to the public at large. If you know anyone that's interested in starting or growing a business, please feel free to have them reach out to us. We'll be happy to assist them in pursuing their entrepreneurial journey. We also have many different sessions that we provide. I would recommend for you to visit our Facebook, our Instagram, and our Twitter, so you can keep in touch with us and see what we have to offer. And of course, our Women's Business Border website. Our Women's Business Center is a funded program through the Small Business Administration. We're one of 117 women business centers throughout the country that provides technical assistance to individuals interested in starting and growing their business. So the benefits of the Hispanic Chamber, our Hispanic Chamber is very unique, it's very different, and our CEO really wanted to provide different opportunities than networking events and coming together. So we have a team of business development specialists that we focus in ranges of startup and how to expand and grow your business. We also have now, because of the pandemic, we have gone virtual. We do have some networking events that you can participate online. And we are the voice for our small minority, women, and veteran-owned businesses. So we would love to advocate on your behalf, whether it's a local, city, or state issue. Please share those concerns with us because we would love to voice your concerns of your small business. Like I mentioned, we have a team of business development specialists that focus in financing, procurement, strategic planning, and some new additional programs that we do have are our COVID business response teams that are here to offer assistance to anyone that has been impacted by COVID-19. And I wanted to share with you a little bit more about our entrepreneurial technical assistance centers. We have our 3 centers operated through the El Paso Hispanic Chamber. We have our Women's Business Border Center, which is a joint partnership of the Small Business Administration. There's also there's a total of 3 resource partners, and we're one of them here. We have our MBA Business Center, which is a funded program through the Department of Commerce. And there's close to 50 business centers throughout the country. And we have one operated here through the Hispanic Chamber. And that's where we help minority businesses expand to the next level. And we also have our new center, which is our Minority Women's Enterprise Diversity Center, which is a funded program through the Department of Commerce, where we target minority women on a national scale to help them and assist them with their business. Before, I wanted to share with our audience that we have some great programs that have just been recently added to our ETA centers. I would say if you know someone that is a business owner that's been in business more than a year and they've been impacted by COVID-19, I would like for you to please give us a call. We have grant funds available from $1,500 to $5,000. We have business kits available available to help your business get ready for this pandemic and succeed in operating. And it's a really nice business kit that comes with safety, safety measures of thermometer, whether it's hand sanitizer. We also are giving gloves. So it's a really nice business survival kit. So please reach out to us at our Hispanic Chamber so we can tell you exactly about more of those programs. So with that, Dr. Lee, I wanted to share a little bit more about our dynamic panel that we have today, and just share with you, we have three dynamic doctors that have allotted some time to share their expertise with us. Our three doctors are from all three different parts of the globe, and I wanted to say just thank you so much for making El Paso your home, where they decided to raise their families and build their careers here. So thank you so much, Dr. Lee, Dr. Toranelli, and Dr. Perez for joining us today. So I just wanted to briefly introduce, I just wanted to also share the full bios of our doctors are on our Women's Business Border Center website. So you can definitely get to know them a little bit more. But just some highlights of Dr. Lee. She is a part of Las Palmas del Sol. She's a part of the Breast Cancer Awareness and Breast Reconstruction. Dr. Lee completed a 5-year residency in general surgery, followed by a 2-year fellowship in plastic surgery and reconstruction at Louisiana State University Health Sciences Center. She also specializes in the DIEP flap and highly specialized surgery to recreate the breast after trauma or cancer. So those are just some quick highlights of Dr. Lee, and thank you, Dr. Lee, for joining us. I wanted to introduce Dr. Toranelli. She's an associate professor of psychiatry at Texas Tech University Health Science Center and she focuses in mental health. Dr. Toranelli, she graduated from medical school in Argentina back in the 90s. She did her psychiatry residency at the Texas Tech University Medical Center here in El Paso, Texas, and she's the director of medical student education in psychiatry. So thank you so much, Dr. Toranelli, for being with us today. Some quick highlights about Dr. Perez. She's the clinical chief of community medicine department at UMC. She's the medical director of UMC Neighborhood Health Care Centers, and internal medicine physician. And so please help me in welcoming Dr. Perez. She also graduated from medical school in Venezuela in the 90s. She graduated from Texas Tech University Health Sciences Center program as an internal medicine physician in 2009. She coordinates and supervises 9 clinics with more than 80 providers, ranging from internal medicine, family medicine, OBGYN, and she is a graduate from UTEP in 2018 from the MBA program. So thank you to all of our doctors for being here and sharing your expertise with our community, which is a very trying time for our community, but we're happy that you're here to share your expertise. So we'll go ahead and get started with Dr. Lee. Dr. Lee, we just wanted to share some some statistics. October is Breast Cancer Awareness Month, and there is about 1 to 8 U.S. women that will develop invasive breast cancer over the course of their lifetime, and about 2,600 new cases of invasive breast cancer are expected to be diagnosed in men in 2020. So Dr. Lee, so we can start a discussion. What do you feel are some early detections that you can share, that you can watch and notice for?
So the key that I tell a lot of my patients is you have to be the captain of your own ship. So you have to know your breast better than anybody else. You'll see your OBGYN or your primary care physician about once a year for your annual exam. And so, in between that time, your breasts will change. And so you need to definitely know if there are any changes to the skin of your breast, to the nipples. The most common finding is that, the patient will feel a lump or a mass somewhere in their breast. and then they'll come in to be evaluated. And the key is to know your breast so that we can detect it early enough, because that could be the difference between life and death, for you. A lot of the red flags, is there could be itchiness to the nipple, mass I already talked about, pain. I've had many women come in and their first complaint is that they've been having pain in their breasts, which, we were taught that, cancer really, I've seen it in my own practice that that's like a common symptom. And then, from there we do our exam, and then goes to the imaging. And
Dr. Lee, I just wanted to ask, when you say pain, I mean, I guess what kind of pain? Because I know sometimes we might say, it was something, it passes. But could you maybe add on a little bit more about the pain that you were just sharing?
it could be a dull pain that just lingers. So patients will come in and say, I've been having this pain for several months now and it just doesn't go away. And then I'll do an exam and I may feel something, I may not. But, then we go and do the imaging, and, from there get a biopsy, and it turns out to be breast cancer. So in my practice, I don't overlook those symptoms when patients come in, because it could be a sign of something else going on. Also, patients who suffer trauma, they fall. I've had several patients who fell, and then incidentally they were able to find a lump which they thought was from the fall or from being hit in the breast. So that was just an incidental finding. But you just have to be aware and be cognizant of everything going on with your body, and don't um, listen to your body, because you'll know best. Intuition.
Sure. So, some signs that are being overlooked, I mean, I guess, when they say that months have gone by, would you say that maybe, a month, that you shouldn't wait for 3 months, or could you maybe give a time frame that maybe someone can be proactive and just take the lead in trying to tell their physician that something's wrong?
Yes, the earlier the better is what I
Okay.
always tell patients and family members. And now with the pandemic, we're seeing patients who are not getting their mammograms, who are afraid to go to the doctors, and I'm seeing more advanced cancers. Patients coming in with large masses that they tell me, well, I was afraid to go outside because I don't want to get the virus. But now they have this cancer to deal with that's more advanced. So I always tell patients the earlier the better, to go see a physician so we can get that ball rolling.
And could you maybe elaborate more what's entailed in a breast self-exam?
So I always tell my patients, pick a day out of the month, every month. So the easiest is your birth date. So mine is on the 15th. So I know that on the 15th. And I like to do mine in the shower, where I can get some, warm water and soap. And then you just, I start from the outside of the breast near the armpit, and you just feel, you just feel everywhere. And then you move on to the middle, and then always check the armpit.
Mm.
My sister, that's the way my sister found her breast cancer. She didn't have a mass in the breast, but she had a lump in the armpit. And so very important to always check the armpit also.
And I guess I would imagine, would the lump be like a soft type of lump, or would it be hard? I guess.
It varies.
It
It
does?
varies.
Okay.
Sometimes it just feels like it's, something soft and nothing. And then when I get the biopsy, it turns out to be a cancer.
Wow.
Sometimes it is hard and not painful, and it's also a cancer. So it can present differently, just
And I could,
depending.
yeah, and I could imagine age is, it really, are there some cases of people that are younger that are still being diagnosed as well?
Oh, yes. My youngest patient has been 18.
Wow.
And so, again, going back to, you have to know your family history. If you're more susceptible to breast cancer in the family, like if your mom, your grandmother, your aunts, just have to have that family history. Then now, we offer genetic testing and genetic counseling, to where if you have the gene for breast cancer, you can do something about it before you get cancer.
Wow. And that goes on to my next question about how has technology advanced breast cancer detection? Is that just some way as well?
Yes, the genetic testing, of course, the imaging that we have available now can see, a very tiny spot in the breast,
Wow.
um, and in the other breasts. So it just gives more information for patients who are deciding what they are going to do with their breasts.
Sure. And I also wanted to ask Dr. Lee, what can we do to reduce the risk of developing breast cancer? Um, how do you feel about that?
So you can never get it to zero, of course, but things that you can do to reduce your risk is eating healthy, exercising, just common sense stuff, maintaining a healthy weight, healthy lifestyle. Don't smoke. Limit your drinking daily to one or two. Has been shown to reduce the risk of getting breast cancer.
Wow. And are there any new studies or developments related to breast cancer that you would like to share with our audience?
Oh, there's daily things coming out all the time, especially at the big research facilities like MD Anderson. I just read an article, bee venom, that has been shown to be able to kill breast cancer in the lab, and then also in mice. So that's something on the horizon that they're going to be studying, and lots of different drugs. And the way we're giving chemotherapy and radiation, that's also changing as more studies are going out there. Now the research, they're also including younger women, because younger women are getting breast
Mm,
cancer, and so that's going to change the forefront of how we treat breast cancer. And of course, the goal is always to get a cure.
sure, of course. And what would you like to share with our viewers about the options of breast reconstruction surgeries and those options?
So remember, when you start in your journey, it takes a team of doctors. It's going to take a village, to help you through your journey. And so, unfortunately, less than 25% of women know what their breast reconstruction options are, because that kind of gets pushed away for later on down the line after they finish their chemotherapy or radiation. And then, at that moment, patients are just, they want to be done. So, either they have a lumpectomy or a mastectomy, and then, the reconstruction part really doesn't get discussed until the patient, is sitting there and then realizes, wait a minute, I really don't want to look like this. Is there, options? And so there's many options available to the women. And I always tell my patients, know your options, make your own choices. That's, the best way I can put it. You can have implant-based reconstruction or using your own tissues. So all that technology is available to women here in this region.
Wow. And I guess we're about to go to our next panelist, which is Dr. Toranelli. But I wanted to ask you, Dr. Lee, what do you share with your patients to help them with their mindset? Sometimes we're not prepared for, these type of diagnosis and, especially in these trying times. And what do you share with your patients that you have to share these news with them, but you also have to prepare them to have a very positive mindset through their journey? What do you recommend to your patients?
So I tell them to gather the troops, because you're going to need everybody to help you, family, friends, as your support system. And very key to have a positive attitude through all this, because, the first thing that comes to your mind when I tell patients the diagnosis, and also when they told my sister, is that I'm going to die. What am I going to do? I don't want to die. And you can't think like that. This is a very treatable, beatable disease, but you need to have a positive mindset and you need to gather the troops around to help you. Who's going to take you to chemotherapy? Who's going to help you with the bills if you have to take time off from work? Who's going to help you with the kids? That support system is really key on how, your journey is going to go.
Awesome. And I would imagine you would connect them to resources and information, correct?
Sure. That
Sure.
knowledge is key. That's the issue.
Great. Well, Dr. Lee, is there anything else you want to share before we turn it over to Dr. Toranelli?
So again, monthly self breast exams and get your annual mammogram and annual exams at the doctor's.
Awesome. Thank you so much, Dr. Lee. Thank you for sharing your expertise with us. And so, Dr. Toranelli, due to COVID-19, a lot of people are spending their time at home, indoors, due to the sudden shift in lifestyle. There are many that are experiencing anxiety and depression, among other things that they're facing. Can you talk about healthy ways for individuals to cope with a sudden change in their lives?
Okay, thank you. Thank you, Mary Helen. Very important question, especially for this crisis that we are having right now. There are many things that we can do to face this crisis. And one of the things is recognize that our feelings are normal. We are having fears, we are having anxiety, we are having anger, frustration. They are normal emotions. And say, if we value our own emotion, is the first thing, and say, the thing that happened now is a crisis, and it's okay to feel fears, to feel all this negative emotion. The most important is how we're going to deal with this emotion. Very important. Take care of yourself. You need to put yourself in the first place, because you cannot take care of other people if you don't take care of yourself. What meaning take care of yourself? You need to sleep well, having a good routine of sleep. Our body needs at least 7-8 hours of sleep. Very, very important. Your kids, they need to have routine. Usually kids, teenagers, they need to sleep more. This is very, very important. We need to have a healthy diet. Look at what's happened right now. Most of the people, they are spending more time at home. And one way to unhealthy coping mechanism is overeat. You are eating because you are at home, and this is not healthy. And so trying to replace the eating with activities. If you need, of course, having some healthy snack available to everybody, but we cannot spend all the time eating at home, because overweight is a risk factor for other medical problems. It is, you are already having more risk to having COVID-19 if you are overweight. And say the diet, your nutrition is very important. Another thing, we don't need to spend all the time watching TV and be immersed in all the news, because it's not healthy. And say we need to be informed about the situation, but not spend all the time absorb about the negative news that we have right now, especially with COVID, with the election. It's not healthy. And say trying to develop other activities. And physical activity is one of the best ways to coping with the stress. Some patients, they are telling me, I'm afraid to go outside. It's fine. You can do physical activity at home. Everybody right now with the technology, they have access to phone, a smartphone, or they have a computer at home. You can watch a video about Zumba if you like to dance. You can do breathing exercise, yoga. This is a healthy coping mechanism. Very, very important. Because we have the risk to having negative coping mechanism. And it's something that we are seeing right now. Many people, they are coping using drugs, drinking more alcohol, smoking, feeling isolated, sleeping all the time, or overeating. This is our unhealthy mechanism to coping with the stress. And it's very important to be aware, because these are the people that they need some extra help. Mm. Be connected with family, with friends, using chat, phone calls. Don't be isolated. This is something that can prevent some mental problem.
Sure.
I
And
don't know
Dr.
if I answered.
No, those are very good parts or good key points that you're sharing with us. And how prominent are mental health stigmas in Hispanic communities and communities of color? Would you mind sharing and giving us some examples and what we're facing with that?
Very, very important point, Mary Helen. We are in 2020 and we are still having stigmas about mental health problems. And of course, there are certain parts of the population that they are having more problem. For example, African American people. If you looking back to the history, people with history of slavery, discrimination, violence, they had more stigmas. What meaning stigmas about mental health? Seeing that if you are dealing with depression or with anxiety, they are the most common mental health problem. It's a weakness. You are a weak person if you talk about your feeling, your emotions, your thinking. Because cultural, they were raised like, you need to be strong, you need to be perseverant, you don't need to show your emotion because this is a weakness. And if we understand this culture, we can understand that people from American people that receive less or they had less access to mental health, they had less chances to be diagnosed with mental health problem, less chances to receive the right diagnosis or the right treatment, because there are also a bias in provider treating mental health problem in African American people, because they don't have a good understanding of the culture. Something similar happening in Hispanic people. If you talk with Hispanic population, they say, we don't talk about mental health problem outside of our family. They are afraid to say, oh, they're gonna call me that I'm loco or crazy.
Yeah.
A lot of stigmas. And Hispanic population, they have other problems, the language barrier, sometimes the legal status, lack of education, the lack of about what meaning feel depressed. All these aspects mean that we are still having stigmas about mental problems.
And especially since we're spending a lot more time at home and having to work remotely and doing homeschooling, is there really an age too? I mean, for treatment, what's the youngest, I guess, of a patient that you've had in mental health?
Mental health affects everybody. We have mental children, teenager, middle age, geriatric population. Everybody can be affected with mental problem. You see, for the kids now have to switch to online school at home. It's a big change in the routine. Think about the life of the kids. It's the school sharing with other kids their life.
Mm-hmm.
You're going to see anxiety on the kids, and this is important to talk to help the kid to dealing with these changes. The same happened with adult and with the geriatric population. Right now they are the most vulnerable, and they are the population that we try to protect more, but at the same time they are suffering because they are isolated. And so it's having contact with older people, having some phone calls, whatever you can do to be connected with them and trying to help to overcome this kind of really bad situation for them.
Sure. And it goes to my next question, Dr. Toranelli. What are some tips of coping? I know you shared briefly in our conversation about some lifestyle changes that you can incorporate, but would you maybe share with our viewers some other tips of coping with everything that we're experiencing right now?
Yes, especially I'm thinking in women. We are having here this meeting for women. Usually women are the ones that they are working, they are taking care of kids at home, especially in Hispanic culture and African American people also, and say, and right now they are overwhelming because there are some people working from home at the same time taking care of the kids, and say is a lot of different in the normal routine. What is my advice? Again, take care of yourself. Trying to talk with your supervisors at work. Say the schedule need to be flexible. Maybe your hour of work gonna be maybe in the evening, because during the day you need to take care of your kids. Ask for help. Ask for help at home. Ask for help with other relatives, with your family. Try to decrease your work loading, because we are multitask, we're doing too many things, and say, trying to be more flexible now, and lower your expectation. We are not expecting that everything gonna be perfect now. This is a crisis. Lower your expectation at work, lower your expectation at home. Ask help from your children. The children can help in some tasks, but it's important to talk.
Mm-hmm.
The other thing that I always recommended, I know that this is hard in this moment, but this is a moment that you need to think about what are the blessings that you have in life. Sometimes a journal, a gratitude journal, they really help to put in writing your feelings. Practice acceptance. We cannot change this situation. We need to accept that this is a crisis and say how we can do it. We can practice more breathing exercise. We can do mindfulness. What meaning mindfulness? Mindfulness is not that you're going to be for hours. No, mindfulness means take a walk and be present. Look at the sky, look at the clouds. Be in contact with your body when you are walking, your smell. Be present, maybe 5 minutes, but these 5 minutes that you are present in the moment, they're gonna help with your brain, because the anxiety and the depression are coming from your brain. There is a small part of your brain that is called the amygdala that sense the fears, the threat. And when you practice mindfulness, be present, breathing exercise, we decrease the firing of this part of your brain.
Awesome. And Dr. Toranene, it goes to my next question. And, I feel it is a struggle for someone to reach out for help, to have that confidence, to know that, they need to take that step in asking for help. What would you recommend as being a doctor and focusing in mental health? What do you recommend for people to take that step if they're listening right now and they're having a hard time with anxiety, depression, feeling isolated and everything that is happening? What would you recommend for them to have that confidence to take that step to reach out for help?
It's very important. The first thing is to recognize the symptom. When we talk about depression, what meaning feel depressed? Meaning feel sad most of the day for several days. You don't have pleasure in any activities that you used to have. You don't have energy. You want to sleep all the day, or the opposite. You're having insomnia. You're having changes in your appetite. You don't have hope about the future. Sometimes you can have suicidal thought. This means depression. Depression is affecting your quality of life. Depression doesn't mean having a bad day that you can feel sad and next day you are happy again, ready to go to work. No, depression is affecting your quality of life. Keep in mind that depression is the number one disease that produces disability in our country. The problem is that sometimes you don't realize that you're having depression, and usually it's the people that are around you that they raise the concern, and this is the key. If you have a friend, somebody that you love, and you notice that there is some changes, you need to talk and be very careful. Don't talk in front of other people, because this is something very private. Try to look for the right moment. Always start with something positive about the person that you love. Tell them how important is in your life, how important all the positive things that they have, but express your concern. I notice that you don't have motivation, and notice that you don't take care of yourself, you don't go to shower, you don't clean your clothes, and say, I'm thinking that you need some help. And you can tell your friend or your relative, I can set up an appointment for you. And the first thing is go to primary care doctor. You're gonna listen Dr. Perez soon, and primary care doctor can, first of all, rule out any other medical problem. Sometimes there is hormonal changes, sometimes there are a sleep problem that can mimic or produce depression and anxiety that they need to be ruled out, but because the treatment is different. And trying to encourage. Always important to talk with some counselor. A counselor is somebody that's gonna see your problem from different perspectives. They're gonna help you to reinforce some positive coping mechanism to deal with the stressor, because sometimes depression and anxiety could be related to some stress. For example, you are having some marital problem or problem with, they can produce some depression and anxiety. But sometimes it's a biological problem in your brain and running in the family. In the same way that we are saying that breast cancer can run in your family, depression, anxiety, bipolar disorder, they can run in your family. And say there are many, many things. A counselor can give you some idea and can say, okay, this is beyond the counseling. You need to be a psychiatrist because maybe there is some medication that can help you to be better.
Most definitely.
Conversations are important to having with somebody that you love that are struggling with mental problems.
Dr. Zaranelli, many in our community, many individuals in our community might not have insurance or healthcare options, but what would you recommend as some affordable resources that are available in our community, and how can they take advantage of them or find them?
Yeah, very, very important. Every community, they have that we call the mental health, the local mental health. That is something that the state provide. Here in El Paso, it's called Emergency Health Network. There is a mental health, provide care for people they don't have insurance, the people they don't can afford some private care, and it's open to everybody. I sent to Tanya all the resources with the address, phone numbers. This is here, it's local. They have some crisis intervention. If for any reason you are feeling suicidal, and there is some phone number, there are people that are already specialized to discuss with you what's going on in your life. There are resources in town. If somebody is struggling with substance abuse is a mental problem. Could be alcohol, could be marijuana, could be heroin, a lot of abuse. They have resources here in town. We have 3 psychiatric hospitals. The psychiatric hospital, they have some intake area that you can go talk, and they can say, okay, this is a problem that can be solved talking with a counselor or in outpatient, or maybe you need some admission. There are resources. Especially now with the situation of the COVID-19, we have a lot of counselors that are accessible virtual. The same way that we are doing the Zoom here, you can be in your home, and your counselor can talk with you through your phone, your computer. A lot of resources. The most important is ask for help. There are some national resources. There are groups, for example, SAMHSA, NAMI. There are groups working with mental health, educated the people. They are easier to find in the internet. Again, I share a lot of resources with Tanya that they can be disseminated to the people.
Most definitely. We'll make sure to share that with them. And like you mentioned, Dr. Toranelli, that you're sharing some very private and personal information with your mental health professional. And what would you recommend for someone to look for in finding the right mental health professional that can help them and that they're a good fit? What would you recommend to our viewers for them?
Okay, another important thing, because some people, for example, are female, sometimes they are not feeling comfortable to talk with a male therapist. It's important to find a therapy that you are feeling comfortable. If your primary language is Spanish, probably you're going to be more comfortable find a therapy that is in your own language, knowing your culture, depending on your sex. There are a lot of things that are important when you search for a therapist. And I always recommend checking with your insurance, what are the options that you have. If you don't have insurance, go to Emergency Health Network. At work usually human resources, they have a lot of programs that they can help you, employee assistance program. Check at work if you have some options. This is important. And sometimes it's like when you go to a primary care doctor, there are some doctors that you like and some doctors that you don't like, and you try again and say, having no good experience the first time doesn't mean that you can continue looking for another therapist. Is very important. And another thing that I want to take advantage, keep in mind, children and teenagers, they need some help. And sometimes the counselor in the school are very useful. Because the kids sometimes they are afraid to talk with the parent about the feeling, and a counselor in the school they can help, encourage the children to talk about feeling and emotion, and talking with a counselor is very important. These are free resources. They are in the school, and they can be very useful. It's very difficult, especially for us, for psychiatry, when we are hearing that there is a teenager or children that commit suicide, because suicide is a preventable disease. And kids, they have some stress, or sometimes with bullying, now with the social isolation, and it's important to discuss at home, feeling, ask help for counselor. It's very important.
Awesome. And Dr. Toronelli, how do you keep yourself healthy, keeping your mindset strong? Because this is a very definitely tough profession of with your clients and what they're experiencing. Would you like to share what you do in your own practices?
Yes, it's very important to balance work, family, take care of yourself. Particularly, I really like to do yoga. I find with yoga, it's very relaxing for me. I try to practice mindfulness, meditation, healthy diet, talking with your colleagues. And another thing, especially for women, and taking advantage of your group, it's very important to make some changes in your life. If you can start a new project in your life, look at all the resources that they show in the beginning that the Business Women Center offer. Say, encourage yourself, empower yourself to make some changes, and make you balance your life. It's important to take care of your kids, your family, work, but it's important also find some meaning in life, because make it.
Yes, your purpose, most definitely, right, Dr. Toronelli? Well, thank you so much for sharing your expertise, and we're going to go ahead and turn it over to Dr. Bettis. Dr. Bettis, thank you so much for joining us today and here to share your expertise as well. Dr. Bettis, can you tell us about some physical health assessment, screenings, or prevention, and why they are so important for people to do?
Absolutely. Thank you for having me. It's a pleasure to be here. And I apologize for the connectivity problem, but I'm here. So thank you.
Awesome. No, we're very happy.
Thank you. So yeah, so the physical health assessment that we as primary care, we do, it's very important for everybody to know that there is what is called annual wellness visit or annual exams. That is the time where the primary care take advantage of do a lot of screenings, because at that period of time, we can capture disease that are there, but people don't know. So that's what is called prevention. If the disease is starting to appear, we can capture it, okay? And some of those screenings, varies according to the age. But for instance, one that is very, very important that is still is causing 500 million deaths of women around the globe is the cervical cancer. So there is a cervical cancer screening that we do that is called the pap smear. It's a cytology that we do. If we do it alone, we can repeat it every 3 years to allow us to capture if something is coming or some these plastic cells or things like that. And if we add what is called the human papilloma virus, that is another test that is important because the human papilloma virus is one of the leading cause of cervical cancer. So if we add the pap smear with the human papillomavirus testing, then we are adding another layer of to be more certain that the patient has or not has, and then we can do it every 5 years if we do it combined. So that's very important for women to ask their primary care or the GYN doctor when are they due, and it's important for them to keep it in the calendar that when somebody asks them, they know exactly when to ask for the appointment and not to lose that time. And it's important also to see how can we prevent that cervical cancer. And there is a vaccine that many people know today, that is the Gardasil 9, available in the United States, and is given as early as 9 or 10 years of age, because we have to give it before people start being sexually active. And also, the moms can, take the kids before they are 15, or if it's before 15, they are going to need 2 doses. After 15 years of age, they will need 3 doses. It's encouraged until 26 years of age. However, other clinicians, they talk that it can be given until 40, but the sooner the better. So I will advise the moms to do it earlier and in their kids to give them that opportunity. And to also to encourage people to have safe sex practice using the condoms and limited the sexual partner. And that is a very important conversation that the moms have to have with their kids because it's there at home where that education starts. And for young women in college and all that, all those settings, to empower them that they have the tools to prevent the cervical cancer, okay? Very important. So another screening that we do, and especially in women's from 13 to before 35 years of age, the chlamydia screening, because chlamydia is one of the sexual transmitted disease that also produce a lot of reproductive problems in women and ectopic pregnancy. And it's very, very important because there are a lot of infertility cases that have been produced for chlamydia, and the patient never knew that they were infected, never looked for help.
Dr. Bettis, I just wanted to add, so is it very, I guess it's not, I guess a lot of people don't have symptoms, something like COVID-19, right? When you're asymptomatic and you don't know that you carry the virus, it's the same thing with chlamydia and the sexually transmitted diseases that can lead to other problems, I would imagine, right?
Correct. And that's what is so important, that when they go to their primary care doctor, so we have to look for that screening. So it's important that the patients, usually they go to the doctor when they are sick, and then they forget this annual visit. So sometimes we have to juggle and put the sick visit with some screening because the patient never go for the annual exam. So that one is very, very important for everybody who is listening today, the importance of to go to your doctor, even when you feel or you think that you are doing okay, to get all these screenings done. And there are other screening, like the HIV screening that is done from 13 years of age to 64. The mammogram screening that I believe that Dr. Lee already talked about. The colon cancer is very important, that the way to prevent colon cancer is to start the colonoscopy as early as 50 years of age. But just the task force just released that because there is an increase of 2% colon cancer per year in the population. So they are bringing it as soon as 45 years of age. So please talk to your doctor, talk to your primary care, because also depending on the history of your family, you might even need it earlier. But usually in the general population, it's going to be now 45, 50 years of age and so forth. So talk to your primary care. Also, for women, it's very important, one thing that is called osteoporosis. So the osteoporosis is a low bone mass and that produces a distortion on the architecture of the bone. And I can compare it with the Swiss cheese. It's like a little, and that makes the bone very fragile. And so if the patient have a fall or a very tiny trauma, they can immediately have a fracture. And there is a way to prevent it, to capture it earlier, that is by doing the DEXA scan or the dual the dual energy absorptiometry, that is like a low dose X-ray, in your body.
Mm.
And there are some measures. And so the first stage is what is called osteopenia, that is a low bone density, but right there we can prevent. And then the second stage is advanced, that is the osteoporosis. So what can we do to prevent? Well, first of all, start with your diet, improving your diet and having a good source of calcium. Like almond milk has a good source of calcium. Eating your veggies and your fruits is very important. And also, I always recommend to my patients to do exercise, aerobic exercise, and we will talk a little later about that. But the weight-bearing exercise is very important because it's going to give the stimulus, if you will, to the bone to develop the mass, the bone mass, and to make it stronger. So those things can be done to prevent the osteoporosis. And usually the DEXA scan, we started when the women is 65 years of age or above, unless that there are other risk factors that the primary care can be looking at, if the patient is in some medication, for instance, long-term steroids, if they are in severe asthma or other disease, they might be at risk. And smoking cigarette, excessive alcohol, and things like that, that we can see if the patient has a risk factor for that. So another very important screening that everybody has to have is the arterial hypertension screening, where we have to take the blood pressure every time the patient goes to the clinic. And before, we used to call somebody hypertensive when they were 140 over 90. So right now, the new guidelines have lowered it to the normal blood pressure should be less than 120 over 80. And it's very important that people who are right there, that they are considered hypertensive when they are 130 over 80 or so. So we have to see what are the risk factors. It might be due to that they are overweight. It might be due that they are obese. So by just reducing the weight, that also can bring the blood pressure down. By also improving the diet to lower the sodium, the salt intake to less than 2 grams a day, that also helps. So all those things, plus adding exercise, also is going to reduce your weight, it's going to reduce the blood pressure, and so forth. And diabetes screening, and especially in this area where we have, as Hispanic, that we tend to eat a lot of food and don't do exercise. So we have to also watch out for diabetes. So we do a test that is called hemoglobin A1C, and it's like we measure the amount of sugar that is deposited, let's call it, on the red blood cells, and that gives us an index. And that index should be less than 5.7. If it's 5.7 to 6.4, is what is called pre-diabetic. And at that moment, we immediately alert the patient not to create panic, but to create consciousness and awareness that they are entering in a very dangerous territory of pre-diabetes. We don't want them to develop diabetes, so they have to really improve the diet, get the exercise done, modify the life. They have to do lifestyle changes, and that is very important. And diabetic when it's more than 6.5. And so that's very important that everybody should know that value if they are in those categories, and talk to the primary care to see what are the things that they need to do to decrease it, especially we women that we have like more fat in our bodies than men, and that's, hormonal and everything. And we have to really advocate for our bodies and really trying to keep up with our exercise. Important as a part of the annual wellness visit, immunizations. Okay, please, we are right now converting into a very dangerous zone because we have the COVID pandemic going on and we have the flu season. Please get your influenza vaccine. Very, very important. Some patients have the myth that they say, oh no, Dr. Perez, I cannot get the influenza vaccine because it's gonna make me sick, it's gonna take me to the hospital. That is not true. Some patients, they might get mild symptoms, but if they get the disease, it's gonna put them in the hospital. So it's very important that the patient get the influenza vaccine. Also see if they are at age to recommend the pneumococcal vaccine, very important, the hepatitis vaccine, the tetanus vaccine, and the zoster vaccine that is available, all those vaccines.
And Dr. Bettis, I wanted to ask you, for women, how important is it for them to maintain their strength and their muscle mass? I've heard doctors use that term, if you don't use it, you lose it. Could you please elaborate more about that for women to maintain their strength?
Yeah, as everybody, it's important to do the exercise to keep the physical strength, the muscle tone, and especially, for instance, when they have urinary incontinence, we tell them to do the Kegel exercise, that is the pelvic floor exercise. But also it's important what everybody was saying, to do aerobic exercise. It can be daily walks, it can be jogging, it can be the weight bearing exercise, yoga, and Tai Chi, for instance, to keep the balance and to avoid falls, to avoid frequent falls, and to prevent osteoporosis. So it's very, very important to do the exercise to keep the strength. But also, I would also add that it's not just the physical strength that is very, very important for your body, but also the emotional strengths that you have to keep, especially women that we juggle so many things and have, tasks at home, the kids, the husband, plus the work. So the emotional and spiritual well-being that everybody has to really think about it. And that's what is so important what Dr. Tonarelli was saying, to learn how to practice yoga, to meditate. That has been said for years and years, and still people do not believe, or they are resistant to do it for some reason, but it works. So I would recommend that as part of the whole, to see the individual, the women as a whole, physical strength, emotional, and the spiritual strength.
And Dr. Bettis, could you share with our viewers a little bit more on how much impact stress does to the body, to your body?
Oh yeah, that's unbelievable, because many people are stressed and they don't know that they are stressed because they don't recognize it until it's too late. So really the stress is a body reaction to a situation. For instance, to COVID, yeah, it's a situation that you feel in danger, you feel stressed. Then your body start reacting with increasing the heart rate. So you might feel palpitation. You might have, your breathing start increasing. The blood pressure goes up. And so that is when the stress start getting into a limit. There are people that feel agitated, frustrated, overwhelmed, because they don't take a pause and they don't think about that what is that they can do to mitigate what's going on, what is within their hands and what is out of their hand. Like Dr. Tonarelli was saying, we can just do what we can, and then the rest let it go because it's too much. But those are pretty much some of the symptoms that they might feel, low energy, headaches that they get because of all the stress, loss of sexual desire, chest pain, for instance. Chest pain is very common that they feel with shortness of breath. So when they start feeling those symptoms, it's very important for them to reach out to primary care, because we together can have conversation and can figure out, okay, do we have to, chest pain, I'm not gonna just say, oh, it's a stress. I have to rule out first that it's not something else going on, organic, that I have to prevent what is called the myocardial infarction, the heart attack. And then if those come out negative, or if I rule out all the risk factors, then we can start talking about the mental health, the stress levels, at home, at work. And in this particular time of COVID, with this global pandemic, as Dr. Tonarelli was saying, the stress level are to the roof in every person, but in women trying to figure out how to handle the kids at home, how to do the job, or if they are working from home, how to do all that things. So that can become really overwhelming and can lead to anxiety, can lead to depression, can lead to all the things. So the person start being in that negative cycle and they do not exercise, they forget about themselves. And that when the really problem comes, because those individuals have to reach out to a friend that is positive, the people who are positive. Please don't go to negative people, because they are gonna, instead of helping you, it's gonna take your energy. So try to keep your circle being positive, because when you are with positive people, then you immediately feel that energy. And I mean, who doesn't need a good energy? Who doesn't need a good group to work with? I'm sorry, but I had to say it.
No, I totally agree. And Dr. Perez, and like I asked the other doctors, would you mind sharing personally, what do you do to keep yourself balanced, your mindset strong? What are your practices?
Well, I'm gonna confess myself that during this pandemic, at the beginning, we were really, really stressed, because at the clinics, for instance, at the clinics of UNC, we didn't have the telemedicine or telehealth, and we were, working pretty much 24/7, Saturday and Sunday. And after we did that, and we saw that, everybody started coming down, because they were able to keep everybody safe, giving that opportunity of telemedicine or telehealth. And also I started, looking back at myself and see, man, I have taken so much. It's a lot of responsibility, which I really do. Very proud of doing my work and very glad to help the community. But also thinking about, Leila, how are you gonna go through this pandemic all these months? Because it's a long thing. It's not a seasonal virus. It's here to stay. So I started, really pushing myself to do the walks, daily walks. And Saturday and Sunday, I do walks with my daughter, because just going outside, do the brief walk and having a good conversation, looking at the beautiful mountains of El Paso, that also help. The breathing, I started doing yoga too, and that's what I recommend. It's amazing after the yoga, how you feel, your body, your stretches, it get the pain away. Is very, very important. And I'm trying to do some balancing exercise too. In all of that, plus improving my diet, because, we at work, we say, oh, I'm going to eat this, I'm going to eat that. Tomorrow I will start my diet. And I said, no, Leila, no more. You got to do it. And so I started improving my diet. Actually, right now I am plant-based diet, and that really has helped me a lot. So that's what I recommend.
And Dr. Perez, how do you feel about the packaged versus like plant-based? Do you think that has a lot to do with the way a person feels?
The what? I'm sorry, the pack?
Like packaged items, or maybe prepackaged items, maybe versus fresh versus packaged.
Okay.
Because of sodium and sugar. I mean, how do you feel that it's best to go natural do you feel a difference as you're
Oh,
doing
absolutely. Absolutely. If you have the opportunity, because again, we have to think about what the person is going through, and then they might think, well, it's easy for Dr. Perez to say everything fresh, but we have to see that now you even have the possibility to order it, and then they bring it to your home, to buy a lot of fruits and vegetables fresh. But if you cannot keep it, all of them, then you can combine some fresh with some frozen, and that is better than nothing, okay? A lot of grains is very important, a lot of grains too. And reduce the amount of red meat is really the one that is the worst, the red meat, because it has a component that is called the trimethylamine and oxide, and that have been proven that it helps building the plaque inside of your coronary artery, inside of the artery, and that can predispose you to have a coronary event later on. So that's why, it's encouraged to eat lean meat or no meat at all, or fish, maybe white meat. But certainly the plant-based diet has proven that really improve your immune system, that improve your energy level, and that it really decrease your the blood sugar levels, and all of those things.
Awesome. Well, thank you, Dr. Perez. And I wanted to go ahead and start maybe asking some questions to the doctors that we have from our viewers. And our first question is for Dr. Toranelli. Do you think our community is more prone to COVID due to diabetes?
There are several factors that they already are identifying COVID. Overweight, being overweight, deficit in vitamin D. Recently, there was released very well research done that people that having lower vitamin D are more prone to COVID. And so this is another, the most important is being overweight. This is already, another factor that was linked to COVID is smoking. And you can see sometimes young people that they are affected with COVID because we have an increase of vaping. They modify the nicotine cigarette now for the vaping, and this is a risk factor for COVID. And so they are a combination. And of course, the lack of practice of measure that we know that can prevent the COVID, like using the mask. I have my mask here every time that I'm gonna leave the office, I use my mask. Practice the social distance, washing your hands. There are measures that prevent COVID. And sometimes, unfortunately, we are receiving some confused message and we are seeing the consequence. We are seeing the consequence of that. Again, if there is other factor, I always think it's very difficult, the situation that we are living, because we are having the pandemic, we have a financial crisis, and people, they need to come back to regular business. However, there is a risk, and we are seeing the consequence. It's very sad right now, and Dr. Perez can also say, seeing that here the hospital, UMC, the Texas Tech, we have tents outside, having patients with this weather that we have in the last couple of days. This is heartbreaking, guys. Say, if everybody can take care and do the contribution, it's a lot of people that can be help and decrease this pandemic.
Thank you, Dr. Toranelli. This is coming from an anonymous attendee, but what are some examples of positive, good coping mechanisms that we could practice to cope with work-related stress now that we are working from home? I guess a lot of us struggle to balance home and work now that we are working remotely.
Yes,
who would like to answer that for us?
I wonder if Dr. Perez want to ask the question. You know, I'm more than happy to do it.
Yeah, before that, I wanted to add something about the diabetes. That the person who asked that question, it's important to know that the more risk factors the person has, it makes them more prone to be more susceptible for the COVID or has more consequences of it, because diabetic people, if they are uncontrolled, they are considered to be immunosuppressed. The immune system is already down, and then being hit by this virus, it can be detrimental. So I don't want to scare people. I don't want to panic the population. But like Dr. Tonarelli said, it's very, very important that everybody create an awareness. And as soon as they feel some symptoms, please look for care. Call your primary care doctor. Call for an appointment. Don't let it go too far that when you get to the hospital, you know the consequences of it. With a coping mechanism, working from home with COVID, I believe that was the question, right? So it's very, very important that right now that we are approaching the winter and people have to be working from home, and they have to also keep in mind that be selective of who you are allowing to come to your home. Being selective doesn't mean that you are discriminating people, but to make sure that if people are at risk out there or having high risk behavior without the mask, without keeping social distance, and you have your grandma at home or little kids that are immunosuppressed, that then if you invite those people, they don't wear the mask in your home, they are going to put you at risk with that. So make sure that you do that. Make sure that another coping mechanism is to do the exercise that we talk, to improve your diet, to do yoga, and don't say, oh, now I cannot do exercise because I cannot go to the gym. No, there are other things that you can do. You have your backyard. You know, you can trying to be creative. Do you have perhaps a stationary bike that you haven't used in a while? Clean that up and put it outside and start, not outside because it's going to be cold, but inside, even the living room where you see a good program. Try to watch the news, but not too late at night, because when you see the news too late at night, then you won't be able to sleep because you are very concerned. And then that's another problem with the sleep. That it's very important that everybody should sleep 7 to 8 hours a day. And especially during this pandemic, to keep our sanity, to keep ourselves working and have the energy to go back to work the next day. And do, yoga as a family. And if somebody has the symptom or somebody have been declared that they have diagnosed that they have COVID, please just make sure that you follow the steps that the primary care is telling you, keeping the person isolated in a room, keeping them comfortable. But when they step out of that room, they have to wear the mask, and everybody around them has to wear the mask. So we limit the exposure of other people, because it's not going to be just one member in that family to be contaminated by everybody else, because we in this area, we are so family oriented. We are so close to each other. We want to hug, but this is not the time of hugging. Unfortunately, this is the time of we being more responsible than ever in showing our respect and showing our love to our family member by keeping them with a distance, by keeping them with a mask, by washing every silverware that they use and so forth, and keep it separated from the other members of the family. I think that all of that is very, very important. And unfortunately, these are very hard and uncertain times for everybody, but that's the right thing to do. I cannot advise things that are out of our hands, but I echo what Dr. Tonarelli said. What are the free things and most easy things to do right now is to wear our mask wherever we go at all times. Keep the social distance and wash our hands if we go out, and even in our home, depending on the settings and the situation, as I just said. But that would be my advice. Some of the coping mechanism at home, and watch some good program, watch history, read a good book. There are many people right now that are coming to explore, that they have new skills that they didn't explore before because they didn't have the time. Like they know now that they can do some artwork, paintings, and that's awesome. Like I increased my culinary skills myself. I found like, oh my God, I'm cooking so much from home at home because of I am concerned to go to restaurants because of that nobody's wearing the mask while they are eating. That's a very high risk environment. So I started cooking and with my daughter, and then we create that bond with her and me in the kitchen. I say, well, if there is something good that COVID has done with us, is that it allows us to express our culinary skills that we didn't know that we had before.
And appreciate a lot of other things too, Dr. Perez.
Yes.
Dr. Toranelli, I wanted to ask you this question from one of our viewers. She's asking, how do we help an older person come to terms with mental health and be comfortable in seeking therapy?
Okay, this is very important because especially geriatric population are the ones that they are struggling the most with technology. You need to support them. And for example, here in our psychiatric clinic in Texas State, we are offering some virtual visit. We don't want to expose, especially geriatric population, to coming here and having the risk of get some infection and say, but they need support. And this is the role of younger people. They can help to set up some Zoom or whatever virtual follow-up that you can do through telemedicine, because this is real. It's happening right now in El Paso. Most of the places they are offer virtual visits. And one thing that we need to avoid is if the people stop having primary care or psychiatric care. Psychiatry is considered also some kind of primary care. If they stop the medication, if they don't refill the medication to control the hypertension, diabetes, we're going to have more problems beside the pandemic, because it's very important the care that especially our older population, that they have a lack of resources they can receive. the isolation is something that you need to be creative, because we want to protect our older population, but at the same time they are isolated, and it's when you need to see how you can help, maybe moving to your home and having some special place and trying to minimize the contact with other people. Or if your older people are in the nursing home, ask for help. Most of the people are willing to connect through Zoom, to Facebook, FaceTime, whatever media that you can use, to keep every day talking with them, sending flowers, something that you say, I care about you. This is the time that we need to tell the people that we care about them, because it's
Most definitely, Dr. Toronelli. And our next question, our next viewer wanted to know about both your opinions about oils. We have seen this trend grow fast throughout the years. What is your opinion? Do oils actually work to make you feel better mentally and physically? I know that they have essential oils. Now we hear about CBD oils and different things like that. How do you feel about that?
CBD is very controversial right now. We don't have evidence that they can help, especially for mental problem. And I always tell my patient, we have a better mechanism to deal with the stress that we know for years, like doing physical activity, doing mindfulness, meditation. This is working because this is something millennium people, they are doing for many years. Try to apply to your life things that we know that they are working. Regarding the other type of oil that you can use like at home to having some relaxation environment, I don't have any problem. I think that it's healthy. If you want to do meditation, what meaning again, meditation? Meditation is trying to be focused for a couple of minutes, because our mind look like we have a million of files open at the same time. Trying to be focused and say for 2 minutes, 5 minutes, trying to concentrate in your breathing. And it's okay if another thought cross to your mind. It's okay, but go back to your breathing. If you are taking a shower, trying to concentrate in the shower. Don't think about what's going to happen later, what's going to happen tomorrow, what happened yesterday. No, trying to concentrate in the thing that you are doing. This is meditation. This is mindfulness. And it's an exercise. The more than you practice, the better you're going to be able to do it. And your concentration will be better. There is an evidence for a different kind of neuroimaging, especially functional MRI, that your brain starts to change after physical activity, after meditation, after mindfulness, trying to do the thing that we already know that they are working. And I totally agree with Dr. Perez, what they say about the diet, a healthy diet. They know that healthy diets, especially Mediterranean diet, all the diet based on fruit and vegetable, they can improve your brain, and they can also delay the progression of cognitive problems that you can have with aging. And say, trying to apply the thing that we know that they are working for many times.
Thank you, Dr. Toronelli. And Dr. Perez, we have a question for you. It says, what do you recommend? Okay, the HPV vaccine and booster, how young could they be tested? I guess is the question.
For the HPV vaccine, I say that it's recommended to start as early as 9 or 10 years of age. Until they are 15, they receive 2 doses of the Gardasil 9. If you wait, because whatever happened, the kid couldn't be vaccinated, you can still vaccinate them until they are 26 and get a good result. However, there are other clinicians that they say that that they can even do it until 40, but that's when I say like it's sort of late, because the women or the person has been exposed to several sexual partners, and that by that time the response of the immunity from the vaccine is not going to be the same as if you started earlier. So if you started less than 15 years of age, it's 2 doses. And then if it's after the 15 years of age, it's 3 doses, what is recommended. And please, the mom had to talk to the pediatricians. And if they already are more than 18 years of age, talk to your primary care doctor about that vaccine, bring that up, have the conversation. It is very, very important, the educational relationship that we as primary care have with our patients. And for the patient that needs to be open, don't be afraid of asking questions. Don't be afraid of asking, concerns that you are seeing there in your community, and you can bring that up, and then we can help you to see how you can prevent things.
Sure. Thank you, Dr. Bettis. And Monique, I know you're joining us on the behalf of Dr. Lee, but we do have a question. Hopefully you can share your expertise on this. It says, I was recently given doctor orders to get a mammogram done because I found a lump in my breast. However, the imaging center is giving me a hard time because I'm under the age of 40. Where else could I go to be able to get this done? Are there any other options for her?
So the order that you have should be good for 6 months. You can actually go anywhere. You can go to Southwest Imaging, Desert Imaging. They shouldn't be really giving you a hard time just because you're under the age of 40. You should be able to still get the mammogram because that is an order from your physician. What you can do is reach out to your physician that gave you the order and see if maybe they can help you find another location. But like I said, Desert Imaging, Southwest Imaging, you can see some of the hospitals, Del Sol, you could see Tenet. I mean, it just depends on where, if you have insurance, where they'll take you, but be an advocate for yourself. Find out who will help you because the center should be taking that order.
Okay, perfect.
Okay.
Thank you so much, Monique. And the good thing is that the order is valid for 6 months. So I think
Yes.
that is reassuring.
Most of the orders that you receive should be good for 6 months.
Okay. Well, I wanted to wrap it up. I wanted to thank everyone, the doctors, my team here, providing the tech support and putting everything together. Thank you so much to our viewers for being here with us today. As a little token of our appreciation, we have Kendra Scott that has provided some little gifts for each of our panelists today as a little courtesy. And thank you so much for all of you and all you do for our community. So thank you so much, and you'll have a blessed day. And please stay safe and stay healthy out there. Thank you.
Thank you.